It's no secret our hospitals are struggling to take care of COVID patients, but unvaccinated mothers now have more to worry about. The news came up at a daily update, and our very own Rachel Robinson was there. Rachel, fill us in on what's going on.
Yeah, today during a conference with Midland Health, one doctor that specializes in labor, delivery, and fertility sounded the alarm about what she's been seeing in the hospital over the past week, specifically in those that are unvaccinated. Local COVID hospitalizations in pregnant women are up, and it's hitting them harder than it did during the first wave.
What I have seen in the last week is different, and this is all because of that Delta variant,
which in turn is affecting their babies. And in one case at Midland Memorial Hospital, causing death.
At lunchtime, I got a phone call that I had a patient that presented with pain and bleeding, preterm, and there were no fetal heart tones. This is my first fetal death in a patient with active COVID.
Doctors think the variant could be causing blood clots. They've seen it in at least 3 pregnant women at Midland Memorial Hospital.
Down the hall that same day, one of my colleagues, not in my group, had a patient with COVID pneumonia, pulmonary embolus. This is a blood clot to the lungs. This patient became unstable, hypoxic, ended up with an emergent C-section, was ventilated during the C-section, came out of the OR ventilated, and I'm sad to say she's still ventilated. We also have another patient in labor and delivery today with another pulmonary embolus, preterm, that as I was walking down the hall, this is what's going on. Another colleague's patient. This patient will most likely deliver prematurely.
And they all have one thing in common.
And all 3 of these women unvaccinated.
Last week, new data from the CDC stated that the vaccine is safe for pregnant women. And Dr. McBrayer encouraged anyone at any stage of pregnancy to get the vaccine.
It is effective. This does not lead to miscarriage. It does not cross over and leave the deltoid muscle and go to the placenta. This does not increase poor outcomes in moms or babies.
And she also wants to stress, it does not affect your chances if you want to have a baby.
I have not seen an increase in miscarriages related to the vaccination. I have not seen an increase in fertility issues.
And if you are pregnant and would like to get vaccinated, talk to your doctor or visit newswest9.com and click on this story. And you can find a link to vaccine locations near you.